Hello, my name is Dr. James Papin. I am a faculty member in the Department of Pathology here at the University of Oklahoma Health Sciences Center, and my research over the past few years has focused on vaccine development for primarily for viral agents, some of which you have heard of, like respiratory syncytial virus or West Nile virus, to others that you maybe have not heard of, like Rift Valley fever virus. And of course, more recently, we've been doing research on COVID vaccines.
Excellent. Why don't we just, if you don't mind, start with explaining the very basics of how does a vaccine work?
Okay, so uh, first of all, we could go for a multi-semester class, right, to talk about immunology and how immunology protects us from infectious agents. But in simple terms, the idea of a vaccine is to expose the body's immune system to parts of an infectious agent without exposing to the infectious agent so that you can build a response before you ever see it and therefore protect yourself either from not getting sick or from getting severe illness in the event that you are exposed to that infectious disease.
So that just makes me curious. Why does how can a vaccine that's so different, like well, I know the Moderna and the Pfizer are both mRNA, but Johnson and Johnson's a different kind of vaccine, and I know like Novavax is working on a different type. How can they elicit the same response?
So the way to think about it is it's just a different way to deliver the information to your immune system, right? So the Moderna and Pfizer vaccines are messenger RNA vaccines. This is the newest type of vaccine to be used in medicine. That doesn't mean that it's a brand new technology. It's been around for over a decade, but these are the first vaccines that we've actually used to fight disease with that, and that is just the basic information that your cells already use to produce all the proteins that your body needs to survive. So they just took that information and put it in your cell in that manner. Something like the Johnson and Johnson vaccine uses a replication deficient viral vector that is able to put that information into the cell so that the cell can produce the proteins for you to make the immune response. And then, like the Novavax vaccine is a more familiar vaccine and a platform that we've used for lots of vaccines, and that is a recombinant protein or subunit vaccine where we actually put the protein in and it's already made and then gets shown to the immune system for a response to happen.
So interesting. Okay, well, I've got tons of questions for you, so I better jump in. At KTUL in Tulsa, will we likely see more booster shots? Okay, that kind of jumps ahead. Let's actually just talk about that. Pfizer is the first one that has asked, is that right, to approve or has recommended a third?
Yeah, so I think that's what's the most recent ask is Pfizer, who has said, hey, we have some data that says that if we give a third booster, we get a significant increase in immunity, which should correlate to a significant increase in protection, possibly longer lasting protection. I think what's important to note about that, though, is that even with the current 2-dose regimen of that vaccine or the Moderna vaccine, we see really good protection already against the Delta variant. While it might be slightly reduced from that we see against the original strain that the vaccine was designed against, it is not substantially reduced to a number that gives concern that it is not efficacious against the Delta variant.
I see. So they are suggesting it. Do we think that some of the others, then like Moderna and even Johnson and Johnson, might suggest a second or another booster?
It's possible that may happen, and as we get more data and we get further out from a large number of individuals being vaccinated, we can follow. They can do studies to follow the immune response and what the long-lived immune response looks like and how protective it might be, based upon community transmission. When we have a wave like what's happening with the Delta right now, that also gives opportunity for us to look at efficacy in a wide range from individuals who were vaccinated as first-line defenders back at the end of 2020, all the way up to individuals who might have been vaccinated as much as a few weeks ago, and have that data possibly compared. I'm not aware of any studies that are going on right now that are clinical trials, but there's probably some non-clinical trial studies that are looking at those numbers.
But in general, the people that had them, those first responders, are and they had the 2 doses. They're pretty much just as protected now as they were when they got it.
So I don't know that we know for sure that what that data looks like. That's data that's still coming in and is still being analyzed. I think one thing to remember, there's been a lot of reports, one that came out of Israel, saying that antibody titer wanes after 4 to 6 months. But that's antibody in the periphery. And what we need to remember in a vaccine is that we're looking to induce immunity, a wide range of immunity. In our immune system, you can kind of look at like our military. There's multiple branches and multiple functions. Antibody that is in the periphery is just one of those functions that protects us, and its main job is to completely protect us from getting infected, right? Those neutralizing antibodies that everyone talks about and you've heard about. So with those high in the periphery, and that would be a reason for a 3rd dose, is to really boost those up and get them high in the periphery for a longer period of time, so that then we can completely block infection. But I think it's prudent to say that complete eradication of SARS-CoV-2, which is the virus that causes COVID, was not ever necessarily the goal. The goal was to stop hospitalization and death. And the current vaccines, even without a 3rd booster, are extremely effective at that goal. They have accomplished that goal very well.
Excellent. Okay. You've answered some of these questions already. So, Pfizer is looking like they might be the first one to get actual approval. Right now, they have all of them have EAU. The 3 vaccines have EAU. So Pfizer's looking at probably being the first one to get full approval this fall, you think? Or?
Yeah, so it looks like with the timeline that is hopeful by Pfizer is that by the end of September, hopefully, or sometime early in the fall, they will gain full approval from the FDA, as opposed to the emergency use authorization that they currently have to administer the vaccine.
What's the difference of they just had, the FDA just needed more time to analyze the data, and then they will determine it's okay?
So I think there's multiple facets that go into that. One could be time, but that time is probably more correlative to the number of patients that have been enrolled in the study. So the packet of data that was presented for emergency use authorization, which is a mechanism that can be used to get something out to the public in an emergency like we've had with the pandemic, is a much smaller packet of data than the data that we now have with all the millions of people who have been vaccinated, that they can now show the safety and efficacy on a much larger scale and show that those numbers hold. And so now they can say, yes, this looks great, and we can give full approval. That takes time though for review and accumulation and I should say assimilation of the data into the packets and submission to FDA.
One thing you said that I just was thinking about, you said that the goal was never to eradicate the disease, but keep people from dying and going to the hospital and those kind of things with vaccination. So if we receive approval on these vaccines, do you think this, and obviously this is probably speculation, but will this become a seasonal vaccine requirement?
Yeah, I don't know that we have that data yet, right? I think that there's still more science to perform to see how often this vaccine is needed. We need the flu vaccine every year because of the substantial change in the flu each year as it circulates the globe. And that is the way the changes in flu vaccines come about is in one way similar to how coronavirus changes, in that you get these small changes as it replicates in its host, but influenza is also much more complicated because it infects other species, primarily birds and pigs, and bird and human viruses can mix in pigs and get new genes, and then that can cause a substantially different virus. So that's why each year we have a new flu vaccine, so that we can address whatever the current circulating strain is. And that decision is made for the northern hemisphere based upon strains that are circulating the previous winter in the southern hemisphere.
So those are different strains, which is different than variants.
Correct.
Okay. So, because that's I think something we don't understand why the Pfizer vaccine from last fall is still going to work on the new variants when we have to get a different flu shot every year. So that asked and answered.
Yeah.
And is that the same reason then, like some vaccines you can get when you're a child that will last most of your life, like for the German measles or
right,
something like that?
For MMR,
Because that doesn't
measles, mumps,
change
rubella.
the main,
Right.
Okay.
Right. So I think something that we're still learning in immunology is why do some agents and some vaccines give us very long-lasting, lifelong immunity, high levels of circulating antibody, like the measles vaccine does, versus other vaccines that may not give as long-lasting. For instance, the Bordetella pertussis vaccine, right? That's a protein subunit vaccine that we use. It has multiple components for different bacteria, but it is, you get a series when you're an infant, you get a booster when you go to school, you get a booster when you're middle school aged, and then once you're an adult, about every 10 years, right? It also has tetanus and diphtheria in the vaccine. So for some reason that vaccine's not as good, right? And part of that is might be the vaccine platform. It might be the adjuvant that I think a lot of people have probably heard that word. That's the extra component oftentimes of a vaccine that helps push the immune system to produce the response that's wanted. And so for the current coronavirus vaccines, I think we just have to look at time. I think there's some data to show that currently the circulating antibody starts to wane after a certain amount of time. But that doesn't mean you're still not going to be protected from severe disease because of other arms of the immune system, like the T cell response. So, not to get too complicated, but those two different arms of your immune system, one is the B cell response, named after where it was discovered in a certain organ in birds, the bursa. That's the arm that makes all the antibodies, right? And then it not only makes these cells that create this high level of antibody in the plasma, they make long-lived cells as well that go back into the bone marrow and pump out low levels of antibody that are always there so they can act as sensors and detect infection. The other is in the design of that side, or that side of the immune system is what keeps you from getting infected. The T cell side, which is the side that is really important for viral infections, that's the side that keeps you out of the hospital and keeps you from dying. So once you're infected, that's the part of your immune system that clears the infection. And that is, that side of the immune response is much more varied amongst the population. And so we don't necessarily see variants arising that escape that part of the immune system. So that would be one of the reasons why we still have such good protection of keeping people out of the hospital and dying, because of the induction of the T cell response by the vaccines.
That is so interesting. Thank you. Okay. So can you just explain, and you talked about it a little bit earlier, but the Pfizer and Moderna both being mRNA vaccines, what's different about them? I mean, is there something different about
So
them?
they're both very similar platforms, very similar, made in the same way. So for, just generally speaking, there's no difference between them. They're the same platform, they're the same technology. They are a very, very similar vaccine.
Okay. So when somebody has a terrible reaction to Moderna, they might have also had the terrible reaction to Pfizer.
Maybe, and there might be small differences like the preservatives used in the vaccine, those sort of things that make them a little bit different. But the primary component of the vaccine that helps you induce an immune response is the same.
Okay.
Yeah.
Where are we with vaccination process for kids younger than 12? Do you have?
So that's a very timely and great question as we go back to school. I think there are a lot of us who wish that we already had approval for our younger children before they go back to school. Pfizer, I know, is working on a study right now, and their timeline shows that they hope to get emergency use authorization for children 5 to 12 years of age within this calendar year, hopefully sometime in the early to mid fall. So they started their study, I believe, in June. I could be wrong. We would need to look up that the exact start time is either June or early July. They started the study to put together the data for the FDA in order to get emergency use authorization in 5 to 12-year-olds.
And I think you had said to me earlier that the reason it's taken a little bit longer for this age group is just really the testing and getting enough. You have to have a certain number of testing.
Yeah, I think there's multiple factors. The primary and biggest factor is that when the scientific community first wanted to get a vaccine to market, we wanted to get it into the most vulnerable population, which is not the 5 to 12-year-old population, right? It is, in the beginning, was, over 60. Now with the Delta variant, that age is much lower, right? But therefore, all the efforts on approval were focused in those demographics were recruited. That's why you saw Moderna 18 and older, Pfizer 16 and older. They really just wanted to look at the adult population to simplify and get that approval to market. So now that has been done, the efforts went to 12 to 16. That got accomplished, and now the efforts are 5 to 12. So I think it's more of a sequencing of trying to get the vaccine out as soon as possible than it is a complication of vaccinating that age group.
This question just came in from Oklahoma, and she was wondering if people have had a J&J vaccine, have you heard anything about that? Possibly they may need to get an mRNA vaccine in the future, or have you heard?
So I don't think that's anything that's necessarily being discussed at the moment. In July, there was a study that came out in New England Journal of Medicine looking at the efficacy of the current vaccines against the Delta variant, and the Johnson & Johnson vaccine, even though it was a single administration vaccine, still has excellent efficacy against the Delta variant. And that study wasn't based on hospitalization and disease. That was a test negative study. So we still have great efficacy against the Delta variant in just testing negative, so not even getting infected, versus hospitalization and death, which is much higher. I mean, if you're vaccinated, you're 99.999% protected against hospitalization and death. So
that's fabulous. And last one is she's saying that San Francisco authorized boosters for people who got J&J. Have you heard anything about that?
I have not heard anything. I have not seen anything about that, so I cannot comment. I apologize.
Okay, I think that we covered everything. Some of these were duplicative questions, so I didn't ask them specifically, but is there anything that you feel like we didn't cover? Or
I think the only thing I would say is there's a lot of discussion right now about masking and should kids wear masks when they go back to school. What should we be doing about masking? And I think what I would say is that even as a scientist and someone who's highly involved in this process, I agree. Masking is getting tough to handle, right? It's something that I do on a daily basis in my work, but outside of work we didn't do before. And we all just got to the point where we were unmasking, and so it's difficult to put that mask back on, and that's completely understandable. So what I would say is that if you're able to get a vaccine and you haven't got one, go get a vaccine, because that's the number one way these will go away and we won't have to wear them anymore.